So prior to doing any suturing, we're going to apply some gloves on both of our hands to make sure that we're not contaminating any of the skin or the laceration. Once we get the gloves on, we're going to take the needle and the thread out of the sterile package, again ripping the package open and then grabbing the needle with the clamp, and the clamp is going to be placed in the middle of the needle where the flat portion of that is, so we don't dull the end or the tip of the needle. Then we can get the thread pressed out, and we're going to take the forceps and lift the skin on the edge of the laceration, and then you're going to go down at a 90-degree angle in that laceration, coming up onto the other side, and then pulling the thread all the way through so you have a little end to work with. The first two loops, you're going to stick the clamp, you're going to rest the clamp at the laceration and do what's called a surgical knot. So we take two loops around the clamp and then grab the little piece of extra thread that we started with and then pull it through. And then the next loop will be just a overhand knot type of thing. So you do one loop around the clamp and then pull it through, and then you do one more a loop around the clamp and then pull it through as well to close. So then we finish off that suture by cutting the edges, so we have about a ½ inch that sticks out on both sides. So here you see the two loops, pulling it through to cinch the incision tighter, followed by the one loop, pulling it through, and then the last loop in the end here, pulling it through. And you're spacing out the sutures about maybe like a ½ centimeter to ¾ centimeter, enough so that the skin will be pulled together and without leaving any massive gaps. And so this first type of suture is the simple interrupted suture, and you just finish it all the way, repeating the same step, lifting the skin to get the needle in at a 90-degree angle on both sides, pulling the thread all the way through to the small end there, and then doing the same movements all the way through the laceration. And here we finish with 5 simple interrupted stitches with a surgical knot. Next we have the vertical mattress suturing technique, and we do the same thing, applying the gloves on both hands prior to starting and ripping open the package with the suturing in it, or the sutures in it. So we get the package open, just like we did before, grabbing the needle halfway on the flat portion so we don't dull the needle tip, and so we have more control over it with the clamp. So bring out the thread. And with this vertical mattress technique, we're starting the same way we started a simple interrupted, like the one we did before, but we're going to start a little bit wider on that laceration. Then you're going to go, the technique is out, out, in, and so we go out both wide on the initial and then wide on the other side, pulling the thread all the way through. But this time we're going to flip the needle over with the forceps and go back towards the starting incision. We're going to start with the needle a little bit closer to the laceration from where we pulled it through on the other side. Again, lifting the skin up 90-degree angle, and then coming in a little bit closer to where we started the very beginning. So the thread will end up on the same side as the starting point. We're going to do the same surgical knot with the 2 loops wrapped around the clamp, followed by 1 loop and then 1 more loop to finish, and then we use the scissors again to cut the thread 1/2 inch away from the laceration. The vertical mattress is nice because it allows you to get, it pulls the wound closer together on, if it's a really deep cut and you want to get the tissue underneath sewn in and the top tissue of the skin layer in there, and it kind of just ties everything really nicely together. So again, we're going about 1/2 centimeter or 3/4 centimeter distance apart. Same thing that we did with the simple interrupted, and just following the same technique with the vertical mattress all the way through the laceration there. So again, we go out, like, or wide, narrow, narrow. And so we're going back in the narrow there, flipping the needle over, pulling it back through the other side. And it helps to keep those forceps on the laceration when you're pulling the needle through, so you're not actually like pulling up the skin too much. So then we do the surgical knot, 2 around, followed by 1, pulling everything tightly together, and then you can clamp off both of those and then just cut it 1/2 inch away and finish the knot. So our last suturing technique is called a horizontal mattress, and it's very similar to the technique we did with the vertical mattress and the amount of surface area that we're taking up. You can usually, with one suture, get more surface area than you could with a simple interrupted or a vertical mattress. So we start the same way, clamping the needle the same way, but this time we're going to go closer to the laceration, same 90-degree technique that we've been working with the whole time, pulling the thread through, so there's a little bit on the end. We're also going to flip around the needle, and then this time we're going to go a little bit up the laceration with the needle like we would, instead of coming back the same direction and over the same insertion that we used for the vertical mattress. We're going to space it out probably like and a quarter of an inch from each other, creating this little box or the horizontal mattress visual. And so after flipping over the needle and returning to the other side, we finish on the side we started with, tying the surgical knot just like we did before, clamping off, and then cutting the thread. And this one's important to grab. You want to be close enough to the laceration where you can pull it together, but not too far, either not as far as you would on the initial vertical mattress. So we go just like a normal distance like we did with the simple interrupted, pulling it through, and then flipping around the needle, going about a quarter inch away from that other side, grabbing the skin at a 90-degree angle, and then getting the needle through the other side, creating that box. And then you hold the forceps to the skin to get the surgical knot, followed by the 2 other overhand loops to finish it off. So next we have wound care, and again we're going to apply gloves before we do anything with the patient. So we put the gloves on, and then we're going to take some gauze, we're going to fold it in half, and then lightly dab away from the laceration, making sure not to pull any of the initial tissue off. And it's important to use different sides of the gauze so that we're not putting the bacteria that we took out of the wound right back into the wound. So then we can get a new piece of gauze and our 22 gauge needle with the 5 milliliter syringe to use to kind of flush out the contents within the laceration. So we use the gauze at the end to dab up any excess saline or fluid, and then that way it'll help kind of flush everything out of the wound. We make sure we take care of our sharps, and then everything that we used on the laceration afterwards, once we clean it, goes into our hand, and we dispose of the gloves and everything appropriately. Next we have steri-strip application. So again, we're going to apply some gloves, and then we're going to make sure that we have the wound cleaned prior to applying these steri-strips. So that would be the first thing to do. We're going to take a Q-tip and apply some adhesive bonding to the edges of the laceration, both edges, to help those steri-strips stick in place. And when applying steri-strips, we're going to start at the center of the laceration first, with a little bit of tension to make sure that those edges of the laceration line up with each other. And then we're going to work about a quarter of an inch apart from the other steri-strips, working from one side towards one end of the laceration, and then going back in the middle and working towards the other. Steri-strips have to be applied a little bit closer than sutures do, because they're not they don't have the same force that a suture does, but it works best on places with minimal skin flexion. And the last video is subungual drilling, and so we're applying gloves just like we did before. We're going to take a 22 gauge needle that we used to flush the wound out in the other video, and we're going to first apply an alcohol pad to rub the surface of the nail. Then we're going to get a gauze pad ready while we take the tip of the needle out, and we're going to use this to kind of bore a hole in the needle or in the nail. And we do that by twisting the needle back and forth until we just get below the surface of the nail, and then the gauze is there to help reduce any like spraying of the blood that could come out of the nail or on the tip of the needle as well. So we keep dabbing the surface until we just poke through with the needle, and then we dab the area with the gauze again, and then wipe it down with the alcohol pad one more time after we dispose of the needle in the sharps can, and then finish off cleaning it with a bandage after.